Nyombi. He's an obstetrician and gynecologist and working at Mulago. That name has a very long name these days. And as well as Roswell Women and Children Hospital. Dr. Jafhar, you're most welcome to share with us a very touching topic, that is navigating and understanding menopause. Doctor, before us, we have caregivers, and these can be very young as 40, some are as old as 50, 70. And we also have old adults who have intentions of aging purposefully. So they may have passed the very crucial ages of menopause, but they still have people around them whom they advise and they live with, and they've shared different moods and all that. So my name is Dr. Christina Kadama, the moderator this morning, and Purposeful Aging is very happy to have all of you. And since we have lost a bit of time, I would like to have Dr. Jafhar starting taking us through this very important topic. Dr. Jafhar, we have over an hour and a half to be with you. Usually we leave about 30 minutes to have question and answers, and the usual interaction between the participants and yourself. Some of the participants may want to put their comments and contributions, queries in the chat room. Otherwise, they will raise their hands and we shall select them to interact. Dr. Jafhar Nyombi, you're most welcome to share with us. Thank you.
Doctor, you're muted in case you're talking.
You're muted, I think. Yes, you're still muted.
Okay.
That is good. You are now audible. That's great.
Thank you. Thank you. Once again, thank you, Doctor, for the introduction. I'm called Dr. Jafhar Nyombi, a practicing gynecologist. I've worked with several institutions, both government and private. I've worked with Mulago National Referral Hospital. I've worked with Naguru Regional Referral Hospital, mainly in private practice now with Roswell Women and Children Hospital, where also that was the medical director for that institution. And I'm glad to have all of you here. I'm glad for this opportunity to share something with you. What did you term your group as? Aging what? Aging, did you say aging?
Purposefully.
Oh, okay.
Purposefully. Yes.
Okay. This is a very interesting topic, I think, but also one of the quite difficult topics to discuss. Even in medical school, it used to come toward the end of the program. So you all know that topics that are normally taught at the end of the program are either boring or less interesting. But in real life, I think it's something that people should give a lot of attention, because for most of our women, they spend majority of their life in almost half or somewhere around there in this period, and it has lots of implications for their life. Well, for this group to understand, I'm sorry I cannot display my slide now. My laptop has delayed a bit, but when it comes, I'll be able to display my slide for everyone to follow. But I'll give a little bit of background on biology so that we understand exactly where we come from and where we go. So as females, I will concentrate on females in our early life. The sex that is determined to be female or even male is determined at fertilization. That is the point where the egg and the sperm meet. So that is where someone is determined to be either male or female by the sperm contributing a Y chromosome, as you may know, for male, and X chromosome, as you may know, for a female embryo. So that is the stage where we determine our sex. However, having the chromosomes XY for male or XX does not exactly show that you're going to have male gonads or female gonads. That is, you're either going to have ovaries or testes. So it's until the embryo is about 5 to 6 weeks, then the process of making sure that you develop either female or male gonads starts. And that goes on for majority of the first phase of pregnancy, and you're fully established as a female by the end of the first trimester. For most of us who have had children, you may be very conversant with trimesters, first, second, and third. So by the end of the second trimester, we are comfortably able to tell that the baby that we are carrying is either female or male. But like I said, for the purpose of this discussion, we shall concentrate on females. So the reason I'm giving you this bit of biology is to know where we're coming from. Now, by the time that you're a fully formed female intrauterine, you're carrying approximately 7 million oocytes or eggs, yeah, to make it simple. And by the time a female is born or a baby girl is born, they have approximately 1 to 2 million eggs. And by the time a girl reaches puberty, they have approximately 300,000 eggs, meaning that as we grow, as we navigate through our lives as girls and women later, the number of our eggs keep reducing. Now, interestingly, biologically, the difference between female and male, the male can continue producing their eggs or sperms in this respect, but for the females, it just continues reducing. Now, that is the basis of menopause. That is the background to menopause. That you have fully functioning ovaries as a young person. At puberty, the ovaries are functioning, they are producing eggs every month until a point when these eggs are depleted. And that is the beginning of menopause. Now, if I'm to define menopause, it's a Greek word, as you know, most medicine evolved in Greece and those other countries. So it simply means cessation or stopping menstruating. And menstruation is the monthly flow of blood from your uterus because of the changes or the fluctuations in our hormones as women are supposed to go through. So when eventually when you eventually stop menstruating, then we say that you have reached your menopause. However, if I'm to classify menopause, it does not just happen abruptly. Menopause, people can tell that, oh, I'm almost hitting menopause. There are a couple of changes that may happen, and there are about 3 stages that we go through before we eventually stop having our periods. There's what we call the perimenopausal period. That is, it lasts between 3 to 5 years, because our menopause, on average, people start having their menopause at between 40 to 55 years. We have seen a few variations of some people getting their menopause a little early, but the range is between 40 to 55 years, and the average is about 50, 51 years. So we have the perimenopausal period, which lasts about 3 to 5 years. And within this period, you're still having a bit of, you've started getting fluctuations or changes in your hormones, the major hormones that influence female functions or reproductive functions, that is estrogen and progesterone. So when you get these fluctuations, you start getting inconsistencies in your period, especially things like reduced blood flow, irregular flow, like you get your period this month, maybe next time you don't get it. You get a bit of spotting within your cycle. So all these other menstrual irregularities that you may think of start happening within that period, and it can go up to about 5 years. Then we have the menopausal period, the actual menopause now. And this, by definition, is when a female does not get, who was previously getting periods, stops to get their period for 12 years consistently. 12 months, not years. So that is 1 year. So somebody does not get their period for a full 1 year, and you have ruled out other things. And it's not because of illness, it's not because this person is pregnant, and it's not because they are harboring a cancer somewhere in their body. So once somebody who has been physiologically having their periods stops having their period for a period of 1 year, then we can conclude that this person has hit menopause. And then we have the postmenopausal period. That is now, from that time, we have confirmed menopause for the rest of that female's life. Yeah, so that postmenopausal period is for the rest of your life. And as we shall discover a little later, this person goes through certain experiences, certain symptoms of menopause or postmenopausal, of the postmenopausal phase. Now, statistically, as I had mentioned before, that most people experience menopausal symptoms by about 40 years. And that is approximately 1 in 100 people. That's about 1%. Then we have also a slight group of about 0.1% that may experience menopause before 30 years. And that we don't call it normal or natural menopause. We call it premature ovarian failure. It means that your ovaries have actually failed before the right time. Yeah, and majority of the people that experience or go through menopause, the statistic puts us at about 45%, that people who go through menopause actually feel that their symptoms are impacting negatively on their daily life and their daily work. So it's very important to know the the mental effect of menopause, because this is where the real problem is. The psychological and mental effects of menopause. This is where the gift of this important topic is. So, so we also we've discussed mainly the physiological menopause, the menopause that happen because of the normal changes or the normal fluctuations of hormones. But there's also what we call the pathological menopause, and this is it accounts for about 50% of women, and this is the one that usually happens before 40 years, the one which we called premature ovarian failure. So there are also people that fall into the category of surgical menopause, and I'm being interrupted by phone calls. So the surgical menopause is when someone's ovaries have been removed, because menopause is really mainly the ovaries, the ovarian function. So ovaries may be removed when they are diseased or during trauma. Yeah, you've had a terrible accident and they cannot be saved, or you had complications of either childbirth or abortions, and then you get severe infections of uterus and the ovaries, or some people get during childbirth, you get other complications like PPH or bleeding, and then at the end of the day, the surgeon may end up removing your ovaries. So there are a number of implications, rather indications of surgical removal. So the people that may get menopause earlier than 30 years fall into that category of what we call pathological menopause. So what has menopause got to do with our systems? There's a lot, and menopause affects the entire female body. All the systems of the body are normally affected by this transition. And it's because the hormones that are mainly produced by our ovaries, which are estrogen and progesterone, like we have already mentioned, diminish. The secretion of these hormones reduces until it stops. And this has an effect on almost every organ of the body. And most of the symptoms of menopause are manifested from every other organ of the body. We shall go through system by system and see what changes happen in each of the body systems and how it presents in terms of symptoms. It has an effect on the digestive system. There's slowing of or sluggishness of the digestion of food when somebody is in menopause, and this manifests in form of constipation. So when people are in that transition or when they've already hit menopause, they actually tend to get a bit of constipation more frequently. And as we shall discuss later, we shall look at how we can improve the quality of life for each of these symptoms. But for the digestive system, mainly it's constipation that comes often as part of the transition. And then in the urinary system, you'll find that the urinary system is more or less like the other hollow organs or systems of the body, like the reproductive system, like the digestive system. So even the urinary system, which is mainly the urethra, the bladder, the ureters, and the kidney, they are affected in their own way. So because of loss of estrogen, which is very important, there's thinning of the lining of the urinary system. So there's less lubrication in that system. the tissues become less elastic, they become drier. So this manifests by a female getting frequent urinary tract infections. And with this one, I want us to be very clear, because majority of our females do not easily distinguish between urinary tract infections and vaginal infections. So we are talking about urinary tract infections and not vaginal infections. We shall get to the reproductive system and see what changes happen there. But people normally get frequent urinary tract infection, and they also get what we call urinary frequency. They visit the toilet very frequently because they feel the urge to pass urine more often. So these are some of the things that happen in the urinary tract infection, in the urinary system. Then in the reproductive system, we have the ovaries, the vagina, and the uterus. The uterus, first of all, becomes smaller. In medical language, we call it atrophy. So it shrinks, the tissues shrink because they are not being actively, using the estrogen and the progesterone, the hormones that are produced by the ovaries. So they start to shrink, including the ovaries, including the vagina. So you may end up having, because distinctly the uterus, I don't know if you're able to see this. This is the shape of the uterus, and this is the cervix, kind of, plus the vagina. So when somebody hits menopause, you end up having almost one block of tissue. The uterus, the cervix, and almost the vagina are one block. But as a very active young person, you have the uterus distinctively separating from the cervix and also separating from the vagina. So that is the uterus. The ovaries also become atrophic. They become smaller, and they tend to be rough on the surface. The vagina also, we know that the vagina has, in medical language, we call it rugi, but it has multiple folds that give it that feel of, the source of enjoyment for the males. So it has multiple folds within it. Now you lose those folds when you hit menopause. And then the mucosa, or the inner lining of the vagina, becomes dry. Yeah, it also starts to irritate. So we have seen many people in the clinic actually complaining about vaginal itching and irritation. And it's not because they have a yeast infection. It's because now there's dryness of the vagina. And as most of you are women, you know that a dry skin will eventually start to itch. So there's plenty of itching and irritation and dryness around the vagina. And ultimately, it makes your sexual experience horrible, because now the sex starts to be painful. Yeah. I'm not sure if I'm audible enough and we are following, but yes.
You are audible, doctor.
Yes.
You are very audible.
Thank you. At the end of the day, there is what we call dyspareunia, or painful intercourse. So this leads to less interest in intercourse and conjugation by the female, as we are going to see the psychological effect of menopause. That also, we include the breasts in this discussion. There are changes that happen in the breasts. We know that our breasts have lots of what we call adipose tissue or fat tissue. So they become thinner. For people who have smaller breasts, they actually become flat on the chest. They lose the strands that make them firm, and the fat that make it, thick. So they become flat and on the chest. For those that have slightly bigger breasts, they just become flabby and pendulous. Yeah. So these are changes that we must accept as females that we normally go through. And if we do not accept these changes, then our mental health is going to be affected massively. So we also have changes on the skin. There's lots of elasticity of the skin. So that makes your skin a bit hanging and full of folds. And the elastin, or the protein that is responsible for making this skin consistent and smoother is lost because there's no support of that hormone. So the skin will become wrinkled, it will get folds, it will become dry, it will easily be injured, and lots of changes on the skin that as you've had. So we also have changes in weight. There's deposition of fat in areas of the hips and around the buttocks and around the waist. And this fat deposition is not the one that we normally see at puberty, where there's a clear distinction of the waist and then the hips and the bum, as we see a young girl developing. Now, this is different. This is a deposition of fat in an irregular way in the waist. Then you start to lose your shape. As a woman, I know women are very, very keen on maintaining their shapes. Yeah, but there's now, you start to lose that shape because fat is kind of distributed in those areas on purpose. And then there are also changes on your hair. Our hair starts to be sparsely distributed in the areas where we have hair, like the armpits, the pubic hair, and then the scalp or the head. And it also becomes dry, yeah, and it breaks easily. Yeah, now we also lose, if we go to the respiratory system, we lose our fine feminine voice. There's lots of fat deposition and changes in the vocal cords, and it makes our voices a little bit husky, a little bit deeper, yeah, as females at that stage. Now we tend to lose that finer low tone voice that women naturally have, apart from a few that may have a little bit of deeper voices. But at that stage, yes, our voices change, as we may notice. Then the neurological system or the nervous system, we have a major problem that happens there in the nervous system, where we start experiencing hot flashes. Yeah, this normally people don't easily notice that there are hot flashes. They start to complain of what people normally call fevers, but it's a wave of heat that washes your skin. It starts slowly. You may have as low as one hot flash in up to about 15 in an hour. That is really the worst part of the hot flashes. But yes, people start to get hot flashes and then they spread. They are commonly in the face, they spread on the neck and the upper part of the body, rarely in the upper and the other parts of the body, but yes, they may also happen in the other parts of the body. Some people actually sweat. They sweat profusely, like they sweat a lot to that extent of even getting wet from the sweat. So hot flashes is one of the symptoms that most people really don't like. Then there are also changes in your bone metabolism. So there's less magnesium and calcium deposited in your bones and vitamin D3. So your bones become weak. So at the end of the day, you start experiencing bone pains. Yeah. So I'll I'll tackle the most important part of the changes in because of menopause. That is the mental changes. Mental health may manifest in so many ways, and there are lots of things that may come with menopause that are related to our mental health. And I think this is where a majority of our counterparts have a problem. So there are things like anxiety. We see a lot of these, I'll not call them abnormalities, but psychological or mental changes. So anxiety is one of them. We tend to get depression. People tend to lack sleep. They are excessively weak, what we call lethargy. You wake up in the morning and you have no ounce of energy. You feel you don't want to go to work. You can't get out of your bed. You know, when you get to work, your vigor is really, really reduced. Then you tend to feel lonely and you want to be in isolation. Your confidence reduces because of the changes we talked about, like the body shape, the effect on your breasts, the performance in bed with your husband. So you tend to lose confidence. Self-esteem also comes with this. Your moods are low. You get mood swings. There are things like panic attacks. There are things like palpitations. Okay, this is not part of mental changes, but yeah, palpitations and panic attacks normally come around the same time. Then your concentration is poor. You tend to get into conflicts with your either your husband and even the other people, workmates, and the people around you. You tend to get relationship conflicts because of the insecurities that you have around you and the stress that comes with menopause. So how do we tell that somebody, what things do we, because you as a lay person may not know that somebody is anxious or they have anxiety or they are depressed. So how do you identify somebody who is having these problems? What are the things that you're able to see and suspect that somebody is going through this? So what do we look out for? We look out for people who tend to withdraw themselves. Somebody is withdrawn. They are probably not taking part in the social activities. When it comes to work, they do not want to easily, interact with other people. When you're having lunch, they probably prefer to sit alone and have their lunch by themselves. So these are some of the symptoms or the signs that we look out for in our communities if we want to look out for these people and help them. Then, like I've mentioned, somebody feels low, either they may tell you or you notice. And then change in personality. This could have been a very vibrant person who likes to socialize, who likes to interact with people, and then their personalities change, and then their physical appearance, like we have described earlier, and then they start to not to come to work because of the lethargy that we've talked about. Somebody actually feels completely weak to wake up to leave bed, so they will not report to work, and then they start giving excuses. So if you're the employer, or you ask questions, and then they also lose interest in the things that they previously enjoyed. They have changes in the sleep habits if this is your pattern, if this is your partner, and they used to, sleep the entire night. Then you see that they are waking up almost every other 30 minutes. They lose sleep in the middle of the night. they can't sleep the entire night. So the changes in sleeping habits are also a warning sign. And then forgetfulness, what we call amnesia, medical language. Somebody will place something here, and then 5 minutes later, they can't remember where they put it. And people start even forgetting people that were close to them, they forget their name. And I'm your spouse and said, your name is Nyombi, Nyombi who? Nyombi, okay, Nyombi Jafhar. So that is how it starts. You even, you start to forget people's names and other obvious things that never used to happen in your life. So it's very key to watch out for these psychological or mental problems during menopause. How do we help or support people who are going through menopause? There are lots there are lots of things that we can do, and majority of them are social. Yeah, we need a lot of social support and behavior changes, nutritional changes. Even before we seek the consultation of a doctor, we need to work on a lot of things, our social circles, nutritional rehabilitation, and then mental rehabilitation. Those are very key. So when it comes to social, how do we support these people? First of all, the awareness. Now that this kind of discussion, maybe some of us will be a little more aware about our symptoms, and then we are able to talk about them, either with our peers or with somebody who has gone through it, or with a counselor, or with a medical professional. And then, we talk about it, get more information, and then see how to deal with it. And then let's learn to listen, learning to listen to people, listen to your spouse. If they tell you that this and this is happening, you listen to them, assess yourself, and then see how you can get help. I'm not sure if there are any peer support systems in Uganda, but just the way we have groups like Alcohol Anonymous for people who have gone through alcohol addiction. There are also other forms. There should also be other forms of support for these people in form of peer support. And then for people, majority of people here should be working in organizations or institutions that are big, that could be having this kind of people. So we need to also have, if we already don't have, workplace policies where we understand these people. We say that they get lots of mood changes, anxiety, depression, and so on. Apart from waiting for somebody to actually commit suicide, if we create an environment where, at work, they're understandable, if it comes to maybe if it's adjusting on their working schedules, working routines, working hours, who are they working with? Are they working with these very young, vibrant people that cannot really understand what they are going through? Can we switch them office, move them from this office to another office where they can easily understand each other? Yeah, so those workplace policies are very, very important. So that, you put in this mother of 60 years and the young girl of 25 years, they are working, they are in the same environment. She's looking at the other young girl's body, looking at her body. And so all those things are very important to look out for. Then what are the other modalities that we may use to deliver help to these people? Like we have mentioned, that we may need counselors to talk to these people, let them know that this is the normal physiology. The normal changes that happen physiologically, and then link them with doctors that may help them to treat them, to inform them about their symptoms and the changes they are going through. Make sure we should also, as spouses at home, improve our sleep hygiene. Make sure you have a comfortable bed. If you already have problems with your sleep, you don't compound it with having a bad, sleeping environment. Make sure that your room is conducive for sleep. Make sure that you have a comfortable bed. Your bed sheets are very nice. You're very comfortable that with 600 or 6,000 threads bed sheets, those kind of things. So, and then relationship support. Now, one of the biggest problems that we get with when people hit menopause are the spouses. And in this case, we are talking about husbands. Now, when they notice that there are changes in this person's body, one, the body, of course, has changed. We've talked about the shape, we've talked about the breast, we've talked about the skin changes, being dry and then wrinkled and all those other things. And also the dryness in the mucosal surfaces, including the vagina, and then the painful sex, and the loss of libido. So the spouses or the husbands may not easily understand that these are normal physiological changes that have now started to happen. So this person needs support. If I was used to this other person who was sexually active, like twice, thrice a week, 4 times a week, and then this person's interest is lost, they can probably afford once a month. This is something that the youth spouse should really understand. So relationship support is very, 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 very key. And if it is not handled well, it has led to loss of breakage of marriages, loss of lives, because I'm sure you've had stories on the news where people complain that, my wife doesn't want to make love to me anymore, and then that's why I killed her. So these are some of the problems that happen in families. So it's key that men have to be made aware. Unfortunately, menopause hits a little faster for women. You can imagine at 40 years, 45 years, and you're in menopause, you're probably having your partner at 50 years or 55 or even 60. He's still a bit, energetic. So he's still interested in sex and all that kind of thing. So he's probably not going to understand easily when this part of his life changes. So those I'm mentioning a few key things, but there's a lot that we can do. But for me, I want to emphasize the psychological and mental changes that happen during menopause. So how do we manage on the medical aspect? The medical aspect of management of menopause. Before we go to the hormonal aspect, I would like to also talk about the non-medical aspect. We've mentioned the psychological, but there's a very important role in your nutrition. Nutrition. Our eating habits when we hit menopause actually change. We start to like junk food. We tend to eat erratically. You wake up, you miss breakfast. Like we said, you already have mood changes. Your appetite is poor. Then you eat a snack somewhere around 1. So people tend to have poor eating habits. So we need to have a nutritional program, specifically during this period. Drink plenty of water. We have already mentioned that our skins are dry. and our mucous membranes are dry. So the hydration of your body is important in solving some part of this problem. Eat lots of vegetables and fruits. These have lots of vitamin C and vitamin E. Vitamin E is extremely key in maintaining the function of the mucous membranes, including the skin. So if we are to continue enjoying our conjugal rights, vitamin E is key. So our nutrition should be addressed expressively during this period. Let's exercise. We have mentioned that there is less storage of magnesium and calcium and vitamin D3. So we get this from our food, but also exercising keeps our bones healthier. That's why people get spontaneous fractures. Yeah, somebody just without anything, any injury or anything, they get a fracture, or they slide, they get a small accident, and they get a fracture in their bones, especially the hip bones. So it's exposure to morning sunlight for vitamin D is important. A thorough nutritional plan and hydration and exercise are very important. So what is the role of the doctors or medicine in managing menopause? We have what we call hormone replacement therapy. As it sounds, it's really replacing your hormone that were previously secreted by your ovaries, and they are not being secreted anymore. So we give them to you to do the role that those hormones used to do. So because your ovaries are not secreting these hormones anymore, we give them to you. So what hormones do we give? We give estrogen and progesterone, and these are the major hormones that we mentioned earlier that your body needs to function as a woman. So the criteria for selecting who to give hormones is very tight, and it's not something you would want to go over the counter and say, okay, I have these symptoms of menopause, you give me this hormone. As a female, you need to be assessed thoroughly well, because hormones, much as they are hormones, they are also used to treat so many other things. They can be used to treat malignancies or cancers. They are used as family planning options and so many things. So before we choose to use hormones on you, we need to assess you. There are hormones that can be given to you when you have a uterus or when you don't have a uterus. So the commonest hormone that we give is estrogen. Now, the effect of estrogen, just the way it used to work when you have your period, it grows your inner lining of your uterus, which is here, the inner lining of uterus, or the endometrium. So once it grows it, we give it to a specific period, and then give you another hormone that allows you to counteract that effect of overgrowing of your endometrium. And at the end of the day, you may get your period. So during menopause, once you're being treated for hormone replacement, you may actually resume getting your periods. So those are the two main hormones. They can be delivered in many different forms. They can be delivered in form of pills. They can be delivered to you in the form of a patch. A patch is a sticker that you may put on your body. They can also be delivered transdermally. It can be put under your skin. Yeah, they can also be delivered in form of injections. So, or even cream sometimes. So when you go to see a doctor, you may discuss and confirm if you need hormone replacement therapy, and those may be some of the options that you may have, or you may hear from the doctor, and you choose whatever it may work for you, whatever may work for you. We have seen I would like to emphasize that even when we want to treat our symptoms, let's not treat ourselves, because there's a risk of endometrial cancer if these hormones are not they are not delivered under a doctor's supervision, because we say that when you give estrogen, you grow your inner lining of the uterus, and if it grows unopposed, it leads to what we call endometrial hyperplasia, and then endometrial hyperplasia is a risk factor for endometrial cancer. So they have to be given to you under the watch of a doctor. There could be other medical supplements in form of vitamin D3, in form of vitamin E, and calcium that can be given to you. These are supplements that may get over the counter, and they are in different formulations. I'm sure most of you have come across them, like Menopause and so many other supplements that you may get over the counter. So they essentially contain supplements. So that for hormone replacement therapy and other modalities of pain, rather, and other supplements. I'm not sure if there are any areas that I have not tackled, but I think I have mentioned most of the things that are important in this session. Dear moderator, I would like to have my discussion ended now, and maybe if there are any questions, I can welcome them.
Thank you so much, Dr. Nyombi. It's been a very, very, very informative 1 hour talk. You've taken us right from creation, when we are still in our mother's wombs, up to the time when we are 60 plus. I'm sure there are questions and answers. Kindly put them in the chat if you have any comments. We'll use the next few minutes to try and answer them. And in case we don't answer your questions, make sure you have registered, and you can always post it to us, and we share with you after the session. As usual, I would like to ask Dr. Philippa to take us through the question and answer session.
Okay, thank you very much, moderator. And thank you again, Dr. Nyombi, for breaking down this giant menopause. I must say it was quite enlightening to see that the entire body changes, and it's bordering on scary. So it's good that you talked a lot about the psychological and mental things that one goes through, because that is a lot to deal with in addition to all the other life pressures that one is having at the same time. I'll go right into the questions. We have quite a number coming in. I would also encourage people to put up their hands and they can voice over, but I'll start with the questions that have come through the chat. We had the first question was, if you start getting abrupt sharp pains, is there something you can do to ease it? Dr. Jafhar, that question came in, but maybe I'll ask the person who asked it to voice over if they find that the answer you give is not, if they feel their question is not properly answered. I'll give you another set of questions before you can, so that you take them together. There's a question about how can one manage heavy periods, perimenopause, during the perimenopausal phase? And then when would you advise to start supplements in preparation for menopause? Remember, we are purposeful aging, so we want to be ahead of things here. And then how are ulcers related to menopause? Dr. Jafhar, I'll let you take those questions first, and then we'll have another set if no one has put their hands up.
Thank you, Dr. Philippa. And okay, I have 4 questions. The first one is sharp pains. How do we ease sharp pains? Now, the person who asked the question was not specific. I don't know where the sharp pains are. Are they in the pelvis? Are they in the chest? Are they in the abdomen? I don't know where the sharp pains are. But we mentioned that menopause takes a toll on our nervous system. And for anything that affects how that system works may give you a whole spectrum of symptoms. Now, any form of pain in the body is mediated by, if it's not psychological, it's mediated by nerves. So if our nerves are also affected during that period, you may experience this kind of thing, but there may also be other causes of pain, especially pain that is coming from the spine. Yeah, from the nervous, from the spinal cord. We mentioned that there are changes in the bones that does not spare the spinal cord. It doesn't spare the bones of the back, say. And if the bones of the back are undergoing osteoporosis or degeneration, they may affect the nerves that are covered in the spine, in the spinal cord. So at the end of the day, you may get radiating sharp pains in your pelvis, in your buttocks, or in your legs, and this may explain that. However, if I'm able to understand where the sharp pains are for this person, we may relate to menopause. How do I manage heavy period, perimenopausal? Yes, we mentioned that perimenopausal, you may get also a varying spectrum of symptoms from heavy bleeding, no bleeding, spotting, regular bleeding, all those kind of things. Now, heavy bleeding has management options, and it's very key to manage it because it will lead to anemia if you don't manage it precisely. There are medications that, and it's stepwise. You may observe it for a month or 2. If it persists, you can start using medicines that directly stop the bleeding. There's one common on the market called tranexamic acid. Sometimes it comes in combination with mefenamic acid, and these two do a lot of wonders in controlling heavy bleeding in the reproductive system. If this does not help, then we have to, because we are almost certain that this bleeding is secondary to hormone changes, then we can now introduce a hormone therapy. And these, again, I stress that these are medications that have to be prescribed to you by your doctor. So yeah, tranexamic acid, mefenamic acid are the medical options, as well as hormone therapy. When do we start supplements? In an ideal situation, if we were able to get whatever nutrients that we have through our diet, would not even need the supplements. So would use nutrition alone throughout the entire life, our life, to deal with our body changes. But because we may not be able to get every other thing that we need, every other nutrients, the micronutrients and vitamins and everything else, we need supplements. Yeah. So these supplements should be started ideally by 35 years of your reproductive life, you should be starting to get onto the supplements, but they should be lower and do a lot of nutritional rehabilitation as you're closing in towards menopause. Then you improve the consumption of these supplements, and throughout menopause, even post menopause, these supplements are key. But ideally, by 35, you should think about using supplements. Are ulcers related to menopause? Well, I would not say that they're directly related to menopause, but we said there are changes that happen in the digestive system. First of all, we mentioned that your moods change. We also mentioned that your eating habits change. These can greatly contribute to development of ulcers. We talked about depression. We talked about stress. So if these are not managed, they are going to lead to secretion of a lot of acids in your stomach and then lead to development of ulcers. We say that the slowing of digestion, and the moment digestion is slowed, you're having secretion of acid and it stays in your stomach a little longer, and then it will corrode your intestinal walls, and ultimately it will cause you gastric or duodenal ulcers. So yes, it is directly or indirectly through those mechanisms I've explained. Thank you so much.
Okay, thank you, Dr. Jafhar. We have quite a number of questions coming in, so I'll just summarize them. The next question is it okay to use the supplements that you talked about? Can we just buy the ones in the pharmacy without a prescription? And then how can one manage hot flashes and maintain their weight during the menopause time? And how can you have vaginal dryness and high libido at the same time? I guess maybe speaking to one having issues of vaginal dryness and yet they'd actually like to still engage in intercourse. How would you help such a person? Or what options do they have available to them? And then if you have had an abdominal hysterectomy, but you don't want to use hormone replacement therapy, what should you look out for to stay healthy? Then someone is asking if you don't want to drink a lot, how else can you help? How can you help her deal with her face? Because she says, regardless of whatever oil they're using, they still have an issue there. And then any herbal options that we would use. This one is specifically for women who are in rural areas who may not have access to, I'm guessing, things in pharmacies, the supplements that you talked about. Are there any herbal options that you know about that could safely be used? And then the role of psychosocial support for women dealing with menopause.
All right, is that it?
Yeah. Yes.
Okay,
Thank you.
Yes, I'll address over the supplements. The supplements don't need a doctor's prescription. These are over-the-counter drugs. You just walk in and discuss with the pharmacist the best option for you. But essentially, the three main components of that supplement, the things that may not miss, that you must look out for in your supplement, have to be vitamin E. It must have calcium and vitamin D on top of the other things. Yeah, you may also have primrose oil. Yeah, in those supplements, it's very important. But yes, but you can just walk to the pharmacy and look out for a supplement that may suit, or even look out for components that you may think you are allergic to, exclude those, and then look for ones that fit your budget and your body. And then hot flashes and weight management. Somebody was asking about hot flashes. we say that hot flashes are mainly the job of the nervous system, the malfunction of the nervous system, and they are likely to intensify in the early stages of menopause. But I also didn't mention that as you grow older, as you grow into menopause, these symptoms actually start to wither away. So much as they are intense in the early stages of menopause, we expect them to keep disappearing as time goes on. But yeah, hot flashes, if you're somebody who does not want to do hormone replacement therapy, because HRT would be the best option to manage them. But if you're the person who doesn't either qualify or you don't want to use hormones, then you need to use something that has a supplement that has a lot of vitamin B complex. Vitamin B complex is very important in the function of our nerves. So, and like I said, hot flashes is a function of the nerves or a malfunction of the nerves. We need to keep our nerves functioning better. So get vitamin B complex, as well as vitamin E for the skin. How can I have vaginal dryness and a high libido? Okay. I'm not sure if this vaginal dryness was just manifested during menopause. Yeah, but these two things are also, they are both affected by hormones and our psychology. So they may not be exclusive, and it's extremely rare that your body will want and your body is not responding. So you may actually want to have intercourse, that is the libido, but your body is not responding to that libido. Wanting to have intercourse is psychological, mainly. And then when your body responds and agreeing with you, then you're going to become wet. But because the hormones that are supposed to do that are not there, then it's really going to be a problem. So we didn't talk about that part where people can use lubricants to help them moisten their vaginal walls, to make it a bit easier. So if you're the kind who still wants to have sex, but you have vaginal dryness, this would be key for you. But there are also other things for people who have had surgeries, either in the perineum, the vagina, or who have had hysterectomy. They may experience and taking part of the vagina, because I'm sure on this forum there are some doctors. You may do hysterectomy total and taking a certain part of the upper third of the vagina. So that may affect your vaginal moisture or secretions during the period of transition. So these are things that you need to be aware of. But if your body still wants, and if your mind still wants, but your body is not responding, you can use lubricants. And like we said, the rest of the other supplements are also key. Someone offering to deal with dry skin. We've talked about drinking, and this person is not very good at drinking water. One of the most important components of managing dry skin is vitamin E. It can be found in the body lotions that may be on the market, which you could have a discussion with a dermatologist, or in the supplements that we have in the pharmacies, or even in the food that we eat. So if you concentrate a lot on providing your body with vitamin E, you may alleviate this problem. What are the herbal options? I am not very, very good at herbal medicine, but I know that aloe vera has a role in, the aloe vera products have a role in in managing some of these symptoms of menopause. Psychosocial support, I didn't get the question around psychosocial support, but yes, maybe this person checked in when we had finished talking about psychosocial support. We said it's very, very important, and it starts at home. People at home should be able to understand what you're going through and support you through it, especially your spouse. Your spouse is key, and I'm talking about a husband here, if there's one at home. If your children are grown, maybe they can also be brought into the picture. They may see you as the backing mother, as the tough mother, you're always angry, you're not receptive. They may really not understand what you're going through, but you can put them into the picture so that they understand, they're able to support you. If there are any other psychosocial groups, you can visit a specialist, you can visit a counselor, we talked about peer groups, and these are very important. Yes. Yes, Doc, I think that's now, yes.
Yes, there are just a few more. One is a question saying, has the Association of Obstetricians and Gynecologists considered a discussion on the standard of care for menopause, as this area has not been addressed? And then someone says it's comforting to know that many of the symptoms discussed are normal for this age group. So they wanted to know if these symptoms will go away, or are they doomed for life to live with all these symptoms? And then, is it usual to have a period of clots, or a period that runs for a few days and then stops and then resumes for another couple of days? And then a question about burning in the toes and stiffness, if you can comment on those symptoms in that age group. I think those will be the last questions that we take if there are no hands that come up. Back to you, Dr. Jafhar.
Yes, you're asking if the Association of Obstetricians and Gynecologists has addressed this. I don't think this particular part of medicine has been given a lot of attention. Yeah, to be honest, it's not something that has been really developed and brought into. Like I even mentioned earlier, even in the training, it comes as one of the last topics that you cover in your program. So it's something that people have not given a lot of attention, and maybe it's something that we may start to advocate for now, even through your groups. We may reach out to the leaders of this association and see how they can enhance awareness through our organization, to reach out to people to help them. Because maybe the way our country is, people tend to forget about when people retire, they are forgotten, and so on. Their quality of life is, not considered as important then. But I think in the current era, it's something that may need a lot of attention. And I think let's see as stakeholders how we may improve dissemination of information and awareness in this special group. Then somebody talked about the period, heavy period, then spotting. We say that in the transition process, you may get all sorts of menstrual irregularities. And this stretch from not having a period to spotting, to irregular period, to heavy period, to very low, very little flow, crampy periods, and all sorts of abnormalities may happen. It varies from individual to individual during this transition period. Yeah, but if it's affecting your quality of life, for example, if you're always spotting, you're in and out of the period, you can always see a doctor to address that, and most likely they may use therapy. Somebody talked about burning sensation and stiffness. stiffness is usually in the joints. Yeah, we've talked about the changes in the bones and joints. Ideally, the secretions in the entire body reduces. We talked about the mucous membranes, but we know that in the joints, there's what we call the synovial fluid that helps to lubricate the joints. So even the secretion or the function of that part of the body is reduced. So there's less fluid in our joints. So when we sleep and we wake up and our joints have not been mobile for a long time, we put them to rest. And this stiffness, if I'm not mistaken for your question, it's commonly in the morning as we wake up. So our joints, we wake up when our joints are stiff and it's difficult to stretch, it's difficult to stand, it's difficult to use them. And it's because of the reduced secretion of synovial fluid in our joints and less calcium deposition in our bones. So we talked about replacement of calcium and vitamin D to improve this. We talked about exercise. If we get our bodies used to exercise, the stiffness will reduce. And then the burning sensation, it is more or less the heat waves we talked about. It's still a function of the nervous system. So let's improve our nervous system function by exercising and using supplements. We shall relieve some of these symptoms. I will be very quick to say that not everyone gets complete relief of these symptoms. You may have a certain percentage of people that don't respond to most of these treatment modalities, but almost 95% of people respond to hormonotherapy. So if these supplementary methods are not helping, you may be assessed for hormone therapy. And hormone therapy does wonders in reversal of these symptoms. Yes, back to you, moderator.
Thank you so much, Dr. Jafhar and Dr. Philippa. I feel there is a question which you need to answer. It's from Anne, and she says, is it usual to have a period of clothes or period? No. Runs after a few days. No, you answered that one, but it was someone who was asking about discharge after sex, which is bloody, and Philippa, you can help me find it. Discharge after sex and bloody. Could you just give a quick comment on that?
I'm not sure if this person has seen a doctor for that, but you remind me of mentioning that in our practice or in the medical world, any bleeding or spotting or discharge after menopause is a danger sign until proved otherwise. So the moment you cross that line of menopause, we said 12 months of no period, you're classified as menopausal. So the moment you cross to menopause, and then you see any form of, because we have said that the uterus is atrophic, the vagina is atrophic, so we expect it to be less secretory. So we don't expect you to have a lot of discharge from that area. We also don't expect you to see any blood from that area. So if there's any form of spotting, sometimes if it's sometimes it's post-coital or post-sex or during intercourse, spotting, bleeding, copious vaginal discharge, those are warning signs. You need to be evaluated for cervical cancer or cervicitis or endometrial cancer or uterine cancer or vaginal cancer. So those are possibilities that may give you an abnormal discharge or abnormal bleeding. So that person has to be assessed.
Thank you very much, Dr. Jafhar. I'd like to once again appreciate your taking us through this journey. It's been very, very informative because on the online we have caregivers who may be dealing with a post-surgery woman and menopause at the same time. But I feel that we are wiser now. We know how to handle first ourselves as women and women around menopausal. And secondly, as caregivers, we can now understand the moods, the changes, the refusal of eating, all sorts of things as we look after the patients, the older people. Someone noted that we do appreciate all the men who have joined us this morning. It's very important to psychologically be aware of what is going on with your friend or your partner as such. And he has very ably taken us through all this. For those who may have questions, please appreciate, we shall handle them directly to you. And those who have not registered, please do register within these few minutes before we close. Dr. Jafhar, thank you so much for bringing menopause and all around menopause close and very understandable to all of us. Thank you so much for joining us, all of you. We wish you a very fruitful weekend. We shall see you at the end of June. At the end of June with another 1.5 hour session. Thank you so much. You can all give a hands up for Dr. Jafhar. Thank you.
Thank you so much, and you're welcome.